I'm excited to let you all know that we recently opened a residential in Northbrook. We have sites for IOP and PHP for adults in Lakeview, Lincoln Park, in Northbrook, and in Naperville. Our residential treatment center is located in Northbrook for adults. And then we also have recently launched our adolescent treatment program, which we're very excited about given the demand for adolescent services, really since before the pandemic, but that's been skyrocketing since the pandemic. And today I would like to introduce our speaker. Dr. Alex Chevalier is a relatively new team member here at SunCloud Health. He has a rare find in medicine and in psychiatry, especially in that he comes to his treatment of patients with the combination of excellent clinical training, brilliance, and a deep heart and passion for adolescents, children, and their families. Alex has been treating patients on various levels of care throughout his career. He has worked in inpatient settings, outpatient settings, and intensive outpatient settings, as well as residential. He did his child and adolescent fellowship at the best place in Chicago to do a child and adolescent fellowship, the University of Illinois at Chicago. And he brings a whole host of, as I said, both academic research knowledge and direct care experience to SunCloud Health and to each of the patients and families that he touches here. I'm extremely excited to have him and someone of his caliber on our team, and also very, very happy to introduce him today to give this talk on the impact of COVID-19, return to school, and adolescent mental health. Alex?
All right. Thank you so much for that introduction, Kim, and nice to meet many of you. Some I know, many of you I don't. My first time giving a Zoom presentation, so please bear with me. I'm a big fan of public speaking, but this is a different experience entirely. So if we will certainly have enough time for questions, I'm going to wrap things up a little bit after 1. So if there's any questions, comments, we will make it possible for you to raise your Zoom hand and or type them in. I definitely plan on getting to everybody. This is a very hot topic. Pretty hard to turn on a television, open up a web browser and not see something related to COVID. And it's actually something I'm thankful for is that a fair amount of that has also focused on the mental health components of COVID in addition to the physical health components of things. It's interesting that these are sometimes at odds with each other, as we'll get into a little bit here. And so in particular, the data surrounding how COVID is impacting the adolescent population is tough to come by. This is true across all areas of pediatric medicine, unfortunately. It is always easier to study adults, and we always know more about what is happening with adults. So we'll touch on the things that we do know, some of the things we don't know, and what we're going to be continuing to observe. As well as kind of trends and how COVID impacts many, many different areas of mental health functioning, and then certainly the pathology that we see in mental health. So my contact information is there, and I'm sure we can get it for anybody who has any additional questions or anything that they would like to speak about after we finish it as well. All right, so just briefly to go over things, just updated my numbers today from Johns Hopkins website. They do a great job of tracking everything. So we are now through 42 million plus cases. Number of deaths are getting close to 700,000. It's 1/500th of the entire US population that has died directly by COVID. And that number as of today was going up at a rate of 1,900 a day. Those are the highest numbers that we have seen in this country since the absolute peak of the pandemic last year in 2020. So we are unfortunately back up there due to the Delta variant and its effects, particularly on the unvaccinated populations. This is not a medical talk on COVID. I am not an epidemiologist, public health specialist, or immunologist, but just to give some few other things to put into perspective. Excess mortality is something that we really don't know. They are starting to do a lot more research into this, both in the US and across the globe. The initial numbers look like in North America, that compared to the number that are directly attributed to COVID, we are still having an excess mortality that's probably 1.5 times that, which puts the total number of deaths attributable to the pandemic at 1 million. For those of you who haven't thought or heard much about this, again, I don't want to get into excruciating detail, but there are a number of instances in which patients aren't able to access care because of COVID, filling up ED beds, filling up ICU beds. That can relate to this. There are people who have deferred care because of their fears related to COVID that are what will be seen as excess death. And the interesting thing about excess mortality is it really doesn't care about what causes it. It's just taking a look at the range of deaths per day, week, locations, coming up with statistical modeling around that, and then seeing what's changing. And obviously the big variable in the past year and a half has been COVID. So again, the numbers are always underrepresenting, but to the degree that we don't know fully. In comparison, flu mortality a year has been very steady at around 40,000, of course, until COVID, where it dropped dramatically because of social distancing and masking. Just to put the number of deaths in perspective here, at least tenfold the magnitude as the flu. I just read this morning that if you combine at the current rate that we're at, prostate cancer, breast cancer, pancreatic cancer, skin cancer, and GI cancer and lung cancer all combined, COVID is still outstripping that combination of the most virulent and deadly cancers at the rate that it is killing folks. Specifically to Illinois, we have had roughly 1.6 million cases and the number of deaths, 27,100. Cook County has one of the highest death rates of any county, or not death rates, sorry, death totals, but that is due in part to its very large population. And so the actual death rates are much more reasonable. Not there's anything reasonable with this than many other parts of the country. And the total number in Cook County is a little over 10,000. And so that gives you a good idea that a huge percentage of the deaths are located outside of Cook. So as far as COVID and mental health in the adolescent population, there have been some dramatic changes, as everybody is kind of aware of. People on this call are adults, so just to keep in mind, school turning virtual is a complete paradigm shift. We have not had anything like this ever before. There have, of course, been people who have tried to do virtual schools and distance learning in the past. It has not been super well studied, and it hasn't been super well understood. Most people in their mind prior to COVID felt like education was in person or kind of a bust. And of course, they've had to change everything related to COVID. There's not, like I said, not a lot known about how to effectively teach using remote teaching methods. And this was seen by the highest rates of kids failing school last year. I'm told there's somewhere in the vicinity of 1,000+%. Over 10x fold in the number of kids who are failing classes. So this is a very, very dramatic change in our ability to disseminate academic information at the very least. Obviously, there are other huge changes. Changing, sports and extracurricular activities. In almost all cases, we've had a big period of cancellation. And now as we're getting back to doing these things, many of the sports are just very difficult to do with COVID. Many of them are requiring, kids to be masked or be separated in ways that they weren't before for practices. It's affecting, the ability of teenagers to interact with each other. Obviously, sport has a lot of value for the teenage population. Hope that's obvious, maybe it's not, and lots of good research about benefits from participating in organized sports for teenagers, but certainly all of those benefits were based on how it was done pre-COVID. It really remains to be seen the impacts related to COVID changing how the sports can even be played. There was a big change with what kids could do outside of the home and outside of the school. And certainly different families have had vastly different responses from kids being effectively like locked in at home and not being exposed to anybody in the world to kids who were like out hanging out and doing stuff like nothing was going on, and family really didn't believe that COVID was real or was virulent or had any of those issues going on. So for any individual adolescent, looking at a very different potential thoughts and responses to what's going on with COVID based on their kind of micro society around them, which I used to include, kind of what news sources they're listening to, what their local culture is, and then of course their family. One of the big changes with COVID is now it is a political statement to determine how you react to this major pandemic. There's obviously been degrees of that before, but for the adolescent population in particular, with the heavy usage of social media, this is a big change in that, your response to, a infection is somehow a signal of your virtues. It's somehow a signal of what tribe you belong to. And that is certainly a contentious issue, particularly depending on where you live and how, kind of red, blue, or purple the area is. It goes without saying to everybody in here, COVID's been a huge disruptor for everything in the adult world as well. And of course, when we have disruptions in the adult world and with adult mental health, that always trickles down to the family unit and the teenagers who are present in those households. So that's a big issue that's come up, and we'll talk about the data around that in a little bit here. And then another thing that we're going to talk about right now is just kind of the huge change in how healthcare has been delivered. The sports stuff's are obvious, the school stuff's obvious, the family interactions are pretty obvious, but healthcare has also had just as big of a turning on its head as I talk to you by the Zoom meeting right now, and how, as school and sports have as well. And so we'll talk a little bit about what that looks like now. So Medicaid does keep some good data. They are very slow to update their data. So this is the most recent thing that they have on their website as of a week ago. And as you can see, this dates back almost 12 months. But there were large declines in the utilization of mental health services. These bars indicate the top two are 2018 and 2019, and then the solid line is 2020. And these are, again, Medicaid across the whole country, and then also just mental health services that we're looking at here. The focus of the talk and what I care about, but just so everybody's oriented here. And so you can see at the onset, if you look in the March and April range here, a very sharp decline. And not only was there the initial decline, but as places did rapidly move to televisits, there was not a huge uptake in the Medicaid usages of those. There is some other data that I have not presented here that has also looked at this, and it's shown that people with private insurance had a higher had a higher rate of going back and starting to use telehealth services, and that was not present in the Medicaid populations. So not only are we talking about a huge decrease in services, but there's also these big inequities that we're going to see as COVID has shined the light on and will continue to. Okay, so in addition to Medicaid data, we have an NSSP database in this country, which kind of actually blows my mind. I didn't know about it, so putting together this talk. Actually, 73% of all ED visits in the country contribute to this database, which is really powerful. It gives us an ability to look at ED data almost like countries that have nationalized healthcare. So you're going to see us go across the globe and talk about things from Australia, talk about things from Canada, talk about things from England. These are all countries that have very powerful unified healthcare systems. Much of the best research in the world comes out of those countries, Scandinavian countries, countries in which you can access the entire population data. So it's not a convenient sample of any way, it's just everything going on. Here, of course, we are only capturing 3/4 of it, but I am very impressed that we can capture 3/4 of it, even from an American standpoint. And so this gives us a lot of insight into what's happening in the US. So this graph is showing you the number of ED visits that were happening in 2019 versus 2020. As is going to be a comment that people are going to be bringing up, and we already alluded to even in the introduction, mental health for adolescents was already kind of entering pandemic level prior to the actual COVID pandemic. There is a lot of data that I don't have represented here about the increased rate of suicidality, of actual suicide, of depression, of eating disorders, of substance use disorders. The list goes on, completely separately from everything going on with COVID. And so that's well encapsulated here. If you take a look at the 2020 visits pre-pandemic and just the difference between 2019 and 2020, there's a huge, almost 50% increased rate that we were on prior to the pandemic. And again, that these effects are seen going all the way back to 2013. If you can believe it or not, a decade ago, one of the craziest statistics I'll tell you is that less than 50% of adolescents had smartphones. That was 10 years ago to this day. If you can teleport yourself back in time and imagine that not every single kid in high school had a cell phone in their pocket, that was actually a world we lived in 10 years ago, which kind of boggles my mind. And so subsequent to that, there have been, big changes in adolescent mental health. The data on all of that is going to be very confusing because of everything that has happened with COVID in the last 2 years. But there was already a lot of work being done on that, and there's continuing to be done on that. It's going to be a very hot topic going forward. But suffice to say that there were very large issues with adolescent mental health prior to COVID. What you saw in the US after COVID spiked is a huge decrease in the mental health visits, right? And this almost assuredly in response to people being afraid to come in, don't want to catch COVID, finding ways for parents, families, other people to just keep you at home. Obviously, the symptoms would still be present, but you're just not getting the treatment for them. Then what we see over time with the ED visits is that they continue to go and climb back up. And so even though people were afraid, even though people were dying at very high rates, and there was not a vaccine out yet, because again, this is 2020, I'm going back into the middle of the year. Certainly adolescents were not getting back. No adolescents in the country were getting vaccinated at this point in time. You're still seeing the rate of visits go up. And so it got to the point where even with the fears people had of COVID, that they weren't able to contain it. How do I know that? Great question. Let me show you the next slide. This is the rate of visits proportionally of mental health visits compared to just general pediatric visits. And so what you see here, 2019, 2020, pretty unchanged. COVID hits, and the percentage goes up significantly. This bar graph on the top line in 2020 compared to 2019 averages about 50% higher that you're seeing. So now the proportionality of mental health visits to regular ED visits is dramatically increased. And so we know that these kids are having to go in and are not going in otherwise when it's related to other physical things that they can get around and avoid. And so, the mental health stuff's bubbling over the top so much that they have to be coming into the ED. And again, this is in this very representative sample of 75% almost of EDs in America. So big issues brewing in the emergency departments. Okay, so how about in other countries? In Australia, they had an even sharper change, but almost the exact same thing as we saw in that last graph. So I didn't include another graph for you, but just statistically, there was a 47% decrease in pediatric ED visits. And again, this is across the entire country/continent of Australia. But despite the 47% increase in total visits, there's actually a 35% increase in mental health diagnoses compared to the year prior. So almost half the total number of people coming in, yet over 35% increase in the absolute number of mental health cases coming in. They also took a look at neonatal diagnoses to give you an idea of perspective. So the hypothesis here is that as kids are at home, not going out and about, there are going to be less sprained ankles, there are going to be less head injuries because football is not going on, they're not playing organized sports, they're not doing these other things. So we do expect some decrease in the reasons that asthma exacerbation actually is one of the biggest ones. So we do expect a decrease in the total number of kids going into the emergency room. For the neonatal group, so infants, they should have no difference between COVID and not COVID. We would expect them to come into the ED at the same rates roughly because they should have roughly the same exposures. They're of course not playing organized sports, although I'd love to see my 11-month-old doing that. And so, that's what they're kind of baseline to normed it to. So they found in their data exactly that. Despite this 47% decrease in pediatric visits, there was a 2% increase in neonatal, effectively no change in neonatal visits. But this big spike, 35% increase in the mental health visits. And so that's for the country of Australia. Okay, below this is going to be one of the few comments I have on some of the adult data. Again, I'm trying to be everything I can to focus on adolescents here, but of course, a little bit is helpful to know what's going on in the adult world. In the adult world, we've very clearly seen over the span of the beginning of the pandemic, big changes in suicide attempts, drug overdoses, and a host of other negative things. Again, the details of that I'm going to be kind of leaving out here. This one in particular is obviously germane to my talk. The number of suspected child abuse and neglect cases coming through the emergency departments are plotted here. This line, again, is going to be your pandemic line. And so you can see, over the span, this actually shows almost 2 years of data. It's a relatively stable chart between this is females and this is males, but you're going to look left to right for time. And it's a relatively stable line for there. After the pandemic, significant bumps in both, at least a 50% increase in male suspected abuse and neglect, and, almost 65% increase we're seeing here for females and abuse and neglect. So huge changes, percentage-wise, things that move the needle 10, 15, 20% would be considered huge changes. These are just blowing the top off that with 50, 60+% changes in abuse and neglect. So what is all this doing on the actual adolescent mental health itself? This stuff is very difficult to research, I will tell you, just because most people don't have pre-existing samples of nice, neat adolescents lined up before the pandemic, that then when pandemic hits, they're able to shift their research and say, hey, what's going on as a result of that pandemic? Interestingly enough, a few people do, and we are definitely going to talk about that. It's amazing research. But in general, this is a tough thing to research because, of course, nobody knew the pandemic was coming, kind of how pandemics work. And thus, getting this before and after sample is going to be very difficult to do. So we'll do our best to parse through what's been published to date. China, for very obvious reasons, as the epicenter of the initial pandemic, has a fair amount of research coming out from it. So these initial talks on the top of this slide are all from China. The first one took a look at rates of depression and anxiety from initial reviews of the adolescent populations. You see a huge range. Again, these are spot analysis of rates of depression and anxiety, and certainly, how you survey this, how you ask this, and who you ask this will always cause a significant range in difference. But we're seeing 22 to 43% spot rates of clinical depression, 18 to 37% spot rates of clinical anxiety from initial reviews after the pandemic. Now, of course, those numbers by themselves don't mean a lot. The question is kind of what did those populations look like prior to that point in time? Again, it's China, not the cleanest of data. This is not Australia or Canada or England that we're talking about here. But based on the largest reviews at that time, we were finding rates of the depressive disorders, roughly around 17%, and then in the anxiety disorders, somewhere in the 10 to 15% range. So you can see that they were still showing significant increases in depression and anxiety symptomatology following based on kind of those estimates that we had from the Chinese adolescent population. The next study I'm referencing here is pulling us back to America. And here is taking a look at people shortly after the pandemic, specifically going through adults to figure out how they feel things are going for their adolescents. Right. Here, the adults note about 27% of them having worsening mental health themselves, and then estimated at about 14% of their children having worsening mental health. And so that's an interesting data point. We are going to talk a little bit more about this. This has been pretty consistent with the pandemic so far, that actually adolescents have done better than adults, even though both populations have done poorly. And so there is a certain resiliency, embedded in youth. And we have seen some of that in the pandemic when we take a look at the values and the absolute numbers. Of course, everything's very early on and we don't have, perfect intervals and knowing exactly what's happening, but that has been a theme. And we'll touch on that a little bit more throughout the talk. Now, of those parents who did report worsening mental health, so that's 14% of the sample that was studied in June of the pandemic, almost half of them had a change in childcare that likely caused significant duress to people in the family. And then certainly a sizable minority had issues with both insurance and food security. Again, we've touched on that, this pandemic did not influence everybody equally. That will continue to be a point, and that was represented by the data that was collected from these adults in June of last year about how things were going in their households. Okay, so again, we are going to shift continents again and go to Europe. This is going to be a big study that is ongoing in England. It is still in its infancy, so there's going to be more coming out of this. There's a very powerful collaborative of groups working in England to get as much longitudinal data on adolescents and their caregivers throughout the process of the pandemic. This was designed very intentionally at the start of the pandemic, saying, hey, look, we think this is going to be a big thing for adolescents. Let's actually look and see what it does. So they were able to get their self, put together pretty quickly and working on getting as large of a population as they could to sign up for this. This is a convenient sample. They are trying, they were honestly taking out ads on like Instagram and Facebook, I think, to get people signed up. They were doing anything they could because it's the middle of a pandemic to get at teenagers and their parents and caregivers to say, hey, let's commit to us, answer some basic questions with us each month, and let's just see how things go. So they used a couple questionnaires. One is the SDQ, a strength and difficulty questionnaire that's really looking at kind of how much functional impairment is an adolescent having. And that was filled out both by the parents and the adolescents. And then adolescents themselves also filled out their own very short thing of how much distress they were in. Right, because this was a very intentional study, it is able to take a look at a whole bunch of demographic information to try to help look to see, are these things causing a covariable, in adolescents' responses. So we know everybody's age, we know their gender, we know their household income, we know whether or not they have any special developmental needs or any neurodevelopmental disorders. So that's going to be a powerful data set going forward. What I'm going to do right now is show you their initial findings. Like I said, there's certainly more to come on this in the wings. Okay, so this is a graph of kind of what scores looked like on that strength and difficulty questionnaire, that SDQ that you're seeing on the side. And obviously, this is intended to give you a broad stroke. This is obviously not something that would be published in an academic journal. There are no values, as you may see, but I thought it was a great idea to just give you kind of a general idea of what they were looking at here. One of the things that has been consistently found is that periods of lockdown have caused the most number of mental health symptoms, and that is what they found here in this English population. So during the first lockdown, they had the highest rates of symptoms across the board between emotional, behavioral, and attentional. You see those got better as things did get better with the pandemic. And then as we started ramping up a second time before we even really knew, but it was related to Delta variant symptoms worsened again. And so the interesting thing about them having this longitudinal data on a month-by-month basis in England is that you can actually see that the symptoms change as the pandemics change. And as we've all lived through after the kind of the first terrible wave last year, everybody was breathing a sigh of relief to some degree. I know I got my first vaccine in December, I got my second one in January, and I was like, ready to put the masks away, ready to go travel, ready to get back to, life at hand. And so that's actually reflected in the data that they have, which is very cool. And now as we get, we're only through March with what they published here, but as we get more data, we will again see the effect of Delta, literally on their self-reports and family self-reports. Okay, so into the more complex data that is actually academic level rigorous here, there is a big difference in how symptoms have affected patients based on whether or not they are from what they consider to be poverty level in England, which is less than £16,000 a year versus non-poverty. So that's the scales on the right. Certainly, higher scores are worse on scales of subjective distress. And so you see with behavioral difficulties, not a huge difference, bigger with emotional and similar with attentional difficulties for the kids who are in poverty. Not super surprising, even with the safety nets in England being a somewhat more socialist society. Under 16,000 quid a year is definitely a very low income, and one in which you can imagine food scarcity. Even picking up medicines only costs a couple quid a prescription, but when you're at that kind of income level, you can definitely see how people are making decisions between basic life needs and even something as simple as a medication. On the left-hand side, where you get an even starker contrast, is going to be for the kids that have neurodevelopmental disorders. So that is what the top bar graph, that orange one, is looking like on the left-hand side. Those are the kids with neurodevelopmental disorders. So kids that have autism spectrum disorders, intellectual disabilities, significant learning disabilities. Not surprising, but they get a lot more at school. There's a lot more resources and professionals involved in their treatment on a daily basis at school, and this was stripped away. So I know personally, when I was doing outpatient work with these families, prior to starting here at SunCloud, this was a huge issue for many of my families who had these children with these special needs. Everything was gone. They're like, I can't get my kid to do a Zoom call for 30 minutes to try to get, this is just not recreating the type of effect, even if there is that, a special education teacher, that speech therapist, that occupational therapist, being able to do that for kids on a Zoom call is just a huge task. And you see it represented here in the difficulties that they had. Okay, so some of the other findings they've had is actually that males and females have responded in a statistically similar way so far. It'd be interesting to see if that holds, but that has been an initial finding that they had. A second finding that they had was that younger kids actually did significantly worse with the pandemic than did the adolescent group. The adolescent group had lower increases in their symptoms than younger kids. And we'll see, again, if that holds up and what that looks like in other countries. But that was a pretty consistent finding for them throughout their time here. The other thing they found was that adolescents were pretty good at reporting their symptoms, and they matched parent report. That obviously depends on exactly the metric you use, but I thought interesting. There's always these questions with self-report versus parent report when you're dealing in the child and adolescent psychiatric space, and they had a very strong correlation between what adolescents reporting and what the parents were reporting, which is nice to see. As I already mentioned, the max of their data that they've released has gone through May, and so there's definitely going to be further impacts with Delta. England has gone through a lot recently with that second wave, and so it'll be interesting to see what that looks like over time. Okay, so I want to take a little bit of time to talk about the theory behind how COVID could impact some illnesses after going through some of the data that we've seen. And this happens to be one of those two studies that we're going to talk about that are kind of these unicorn studies. They were already having a population of kids that were engaged in this longitudinal research where they were following them for many, many years for reasons I'm about to tell you about. And then as COVID hit, they were able to adjust what they were doing, what measures they were looking at in their research methods, and were able to include COVID as a new thing to look into in addition to what they were already researching. And so these, at least for me, I'm most excited about from a research standpoint because you have the baseline data that's incredibly pure. You've got that perfect sample in which all the randomization and all the controls were done for it. There's nothing convenient about it. It's a very much a prospective study model that is going to give us the purest data. And then you have the pandemic hit, and then you have what happened from there. All right, so the Z guy, whose name I'm not going to try to pronounce, published this initial paper. This was based on a sample of a couple hundred children that they were already following since birth. And what they were following them for were specific markers of anxiety and the pathology of anxiety. For those of you that haven't thought a lot about developmental anxiety, which is probably many of you in here, I'm going to walk you through that real quickly, okay? When kids are very young, they can be rated on a temperament, and a temperament that approximately 15% of kids have is called behavioral inhibition. So this is toddlers who are slow to warm, who are afraid of new people, doing new things, and tend to be considered like the shy toddler, sometimes the more tearful toddler. That's what the phenotype temperament of behavioral inhibition looks like. So they specifically went to recruit kids who had this phenotype in this study, and then they wanted to follow them and see how did that phenotype progress. The next big wave of change in kids that go on to have significant clinical anxiety is a measurement called social weariness. Right? Social weariness is measured in the elementary school ages, in this study at the age of 7. And they look to see, what percentage of kids were going from behavioral inhibition to social weariness. The socially weary kids, again, are going to sound like the name implies. It's similar to what they were already expressing when they were younger. But when going into new social circumstances, they already expressed, anxiety, worry, and this is not a simple and pleasant thing for them. So, starting elementary school, going into new classes, doing new things, all related to, measurable a level of weariness that are based on observational scales that kids have done for them. So for kids who meet that threshold, they had that early childhood temperament of behavioral inhibition. In grade school ages, they have social weariness. They go on to adolescence, and then they get measured on degrees of dysregulation. So we have emotional dysregulation, we have behavioral dysregulation, and then a third area dysregulation that we look at is worry dysregulation when we look at adolescent populations. So these are, again, kids who have been assessed on at each of these time points over the last 15 years at each of the spots. And then the cool thing that happened is that this cohort happened to be 18 when COVID hit. And they were able to go and get a bunch of measures from them after COVID hit to take a look at what their response was to the potential for significant anxiety related to COVID. So the big findings that they had from this is that they're in kids who had each of these levels of not necessarily clinical anxiety disorders, but the precursors that we think come to many clinical anxiety disorders. When COVID itself hit, they had much more anxiety than the people who were in the study, even had initial behavioral inhibition, but did not go on to have social weariness and worry dysregulation. And so even amongst these kids who are all born with this anxious phenotype, we see that those who progress to go on to have the symptoms that we were looking at ages 7 and 15 were significantly more likely to have a pathologic response to COVID than kids who did not go through that pathway. Right. The interesting thing here too to note is that they also looked at other functioning for these kids when they were 15, and kids that had significant mental health symptoms, who had significant problems with their emotion regulation, with their anger regulation, did not associate with higher rates of COVID-19 anxiety. So that gives us some fidelity in thinking, there's something specific to this pathway as opposed to just overall emotional issues. Overall, you can certainly imagine kids with anger dysregulation coming potentially from backgrounds and having life experiences that led them to that way. And despite all that, that is not being associated with this increase in COVID-19 anxiety. So this whole model and what we're looking at here is a very classic example in mental health and in other areas of medicine of what we call like the stress diaphysis model. And so this means that you had a genetic or epigenetic or early childhood predisposition to have a potential problem. So in this case, again, this is all the kids represented in the sample who were found to be in this behavioral inhibition phenotype early in life. And then what happens is you have a stress on top of the predisposition that you have, and then the combination of the stress and the genetic, epigenetic, or early life experiences combines to create pathology. So I thought this is a very nice study that has gotten a chance to take a look at this, and it kind of goes exactly as people had thought. Nothing earth-shattering, but the fact that we were able to track this and see this over the last 15 years is a pretty powerful look. And I think they have some more data coming on these kids too. So speaking more specifically about different types of anxiety now, COVID-19 and social anxiety is at the very top of my list of huge concerns. And this is a concern shared by many child and adolescent psychiatrists. Social anxiety, one of the bigger concerns of all anxiety or any mental health issue in adolescence, just period, is interesting in that when COVID hit, we would expect that there was a significant decrease in their reports of anxiety and their experiences of anxiety. That symptoms got better for these kids. If you were socially anxious, being around other people, answering questions out loud in class, giving reports in front of other people, sitting in the lunchroom and being judged based on how you look, how you eat, who you're hanging out with, those are the worst things imaginable to a socially anxious kid. And when COVID comes through, all that disappears. So we actually saw many adolescents, I did at least in my personal practice and what we're hearing from other folks, that had these symptoms, and all of a sudden they're doing better in school. Their reports on some of these measures are going down of their distress, and their grades are going up. Wow, great, you say, right? But definitely not great. Okay, the big issue with social anxiety disorder here is that the ability to expose you to these situations that make you anxious, the ability to have you in the situations that are difficult for you, is the paramount ingredient to making sure that the pathology does not get worse and ideally gets better, right? But when these kids go on and listen to the TV from great leaders like Dr. Fauci, they are being told that by socially distancing, not doing anything with other kids, staying in their home, and being totally by themselves, that they're this great person who is helping the world and saving people's lives. Is that true from, a spread of a pandemic standpoint? Absolutely, right? But, those messages are hard to counteract. I mean, it is true. It is absolutely the case that doing that was helpful, would be good for the world. And if everybody did it, we would not have, 1 in 500 Americans dead. But for people specifically with social anxiety, particularly kids, this is a very hard message to kind of balance in your head. Social anxiety, at a baseline, it functions very heavily on negative reinforcement. So for those of you who absolutely hated Psychology 101, I'm not going to drive into this point too hard here, but negative reinforcement, even sometimes more so than positive reinforcement, which is, of course, you do something and get a reward for it, and that positively reinforces it. Negative reinforcement is when you remove a negative stimuli, and that thus positively reinforces it. So for anxious kids with social anxiety, their whole life is built around negative reinforcement, right? Anytime they're worried about doing something, they get a stomachache, they go to the bathroom, they get a doctor's note, they just skip doing the presentation, they go away from things. And then that temporarily relieves their anxiety. And so a combination of being told, hey, this is what you should be doing, is staying away from everybody, and them saying, oh my gosh, I feel great. My grades have never been better. My mental health's never been in a better place. We have this perfect storm that one, we then say, hey, surprise, you're going back to school now, like we did a month ago. It's the perfect storm for causing really apocalyptic responses, which we have already started to see in clinical practice with this return to school. Now, all of a sudden, you've been away for so long, and you just get this flood of socialization, all those fears that you had about the judgment, about your performance inadequacy, they all come roaring back up. And because you've had so little experience, is a little bit like the classic technique of called flooding, in which we used to treat people, at least, you know, in the psychology world, with things they're scared of by just giving them a million things of that. This is kind of akin to treating, you know, somebody with arachnophobia by dumping 100 spiders in the room or having spiders crawl over them. And what we learned when we did flooding 20, 30, 40 years ago is that it's a terrible technique and it leads to bad outcomes. And so that's exactly, unfortunately, what our youth are going through right now. These concerns are certainly my own from my own clinical practice, but well represented in the child and adolescent psychiatry community, as I'm quoting there. Other big impacts of COVID on mental health. So sedentary behavior has changed significantly since COVID. This relates some to the social isolation that we're talking about. This chart was produced by researchers in China, getting adolescents to enter the total number of minutes that they were doing certain activities, which is really nice. It's not a judgment on anything. It's not mental health related in any kind of way that's obvious for them doing this. But you can see here, obviously, before the pandemic, during the pandemic, there's just this dramatic reduction in physical activity, right? This is a greater than 80% change that they're seeing here. The inactive times have gone up over 300%. Total screen time has gone up 400%. So not a surprise to anybody, but still good to just see the data being collected from somewhere and seeing how incredibly dramatic these changes were. The reason this is particularly relevant to us as psychiatrists is that physical activity is definitely known to improve mental health. And then this sounds like the same thing, but is actually a slightly different knowing and finding. Sedentary screen time is also known specifically to worsen mental health. And so those two activities, you know, well, the physical activity, that positive, that reinforcing resiliency factor is going away. And then that negative factor, that sedentary screen time, is going up dramatically. So huge risks for lots of things in mental health related to that. Right. They also took a look in the same study, and this was a study, just to give you full disclosure, that was trying to figure out if there was going to be an increase in gaming and social media addiction. So this is really an internet addiction study that was being done, but of course their data is very relevant for us for other reasons as well. And actually, they did not have huge findings in what they were primarily set out to find, which is interesting, and I'm going to touch on too. But here you can see when you took a look at what their baselines means were, and then what their follow-up means were, smartphone usage doubling. Gaming usage actually had a very small increase, much smaller than they were expecting. Social media use, on the other hand, is nearly tripling. And then these four things you see on the bottom here, well, actually, the first three these are the addiction scores they're looking for to look at social media and gaming addictive behaviors. And so those are the ones that actually did not find large changes in. DAS-12 is, the DAS-21 is related to emotional findings. And so we'll talk about that next. This was just to go back to the sample size. We're talking 4th to 6th graders, so a little bit younger than the adolescent range, but getting really close. There's no change that slide is not worded correctly, but the interesting thing was there was not a change in the addictive internet behaviors. This is what they thought that they were going to find in this age range, and they did not find it. Some hypothesis that this might have been related to the kids being a little bit too young for this to be the effect. But as we know, certainly kids in this age are using a lot of these things, and they were able to track that. What they did find is that those who did have those addictive internet behaviors had significantly worse psychological distress. So that's at DAS-21, that last line here. You see this marked increase in the DAS-21. And those were amongst kids who did have the pre-existing and then continuing levels of addictive internet behavior. Okay, so talked about not moving around a lot, talked about social media a little bit. Corollary to this also is going to be related to weight. So this is going to be an American study. Kaiser Permanente Medical Group is kind of the closest we have to a nationalized healthcare system. They get all the data on all their patients who are kept in this very tight HMO. They try to have all of their services come through Kaiser Permanente. Many of you may be familiar with them, but for those of you who are not, and so their data sets are very, very powerful when you're taking a look at US populations. They tracked weight at their primary care offices. and they had these findings. There was a significant increase in weight gain over the time period following the pandemic that they saw in kids aged 5 to 15. There was about 5 pounds of increase over what was predicted. So keep in mind, these are kids. They are following growth curves. We totally expect them to gain weight. And so what they're looking at is kind of like that excess weight gain, much like I talked about excess mortality at the very beginning of the talk. This is all statistically analyzed to take a look at what weight gain is gained over what we expect them to gain. And then similarly, but to a significantly less degree, the older adolescents had 2 pounds of weight gain increase in that time. Now, those weights don't necessarily sound dramatic in and of themselves, I think, depending on how you look at it. I'll tell you, in the 5 to 11-year-old range, the increased rate of kids that then qualified to be overweight or obese was a 23.8% increase related to this change. And so that's a pretty dramatic effect in this one area. Okay. So the other big things that come with these increases in weight is certainly that this is a significant risk factor for eating disorders. Already seeing this in our clinical practice here, but that is certainly the case that as kids are going up in weight and thinking about this more, big issues can come down the road from that. And then certainly just gaining weight in general, meeting these criteria in general, can go on to cause other issues for adolescents related to body image, social anxiety, can change their thoughts about a lot of parts of their body. Now, of course, we don't know the causality related to all of these things yet. There are a lot of complicated factors at work here. Certainly, there's almost assuredly some component related to physical activity, some component related to using diet to manage anxiety and stress. But then there's also, a global pandemic going on, many kids having more food insecurity, which we touched on in that early population. It was saying about 1 in 9 families where they saw worsening mental health was actually weight, associated with food insecurity. And of course, food insecurity might not just mean, that you have no food, but it might mean you're eating significantly worse food, and that can contribute to what you're seeing here. So COVID and eating disorders. We have one really nice data set from the University of Michigan. They run a large academic practice and so have a pretty big cohort of adolescents with eating disorders that they treat on a regular basis. This data is quite recent, and they have found that since the beginning of the pandemic, there's been a 123% increase in medical admissions for restrictive eating disorders. And so for those of you who might not spend a lot of time in the eating disorder arena, they are looking at people who are getting medically admitted that their weight is so low that they require inpatient hospitalization for refeeding in a medically safe way. So these are things that, certainly the number of kids coming in for that should not be heavily influenced by the pandemic. There's certainly a realm for them to have a little bit less in services, but kids who are at this weight, they need this treatment. And so we're seeing these gigantic increases from this one study at their one site, but this is certainly something that we're hearing about from other places. We recently were talking to folks at Lurie, and they mentioned that they had a very similar experience in the Chicagoland area as well, with the work that they're doing over there. All right, so there's certainly part of the eating disorder world that is complicated by telemedicine visits. So we didn't touch on that a lot for other disorders. The data is still very unclear how telemedicine is going to look for efficacy in treating depression, anxiety, things like that. We had studied telemedicine before, but never at the rate that we are studying it now. So we're going to get a lot more light shed on that. But eating disorders are very specific in the fact that when you do telemedicine, it is essentially impossible to get vital signs, blood pressure, heart rate, things like that, especially in the orthostatic range that we would really want to see them. Very difficult to collect at home during a pandemic. Yeah, there's the odd patient who has access to this stuff at home, but not a common experience. Weight becomes even complicated to get because getting a blind weight from a patient is all of a sudden a much bigger ordeal. You'll have to get something from a parent. They have to be involved and cooperative. So there's some very significant differences when you're doing telemedicine visits in the ED world, and a lack of some of the data that is also going to complicate things moving forward. Now, why there's this big of an increase, certainly our understanding of eating disorders to date shows that when adolescents have higher rates of depression and social isolation, that they are at increased rates for developing eating disorders. We also mentioned that as adolescents have issues related to dieting and their weight going up. They're at dramatically increased rates for eating disorders. And then there is new and ongoing research to show that social media usage itself is tied to increased rates of eating disorders. So we have kind of had this perfect storm with both the increase in social media and COVID, and what that's done to cause isolation, and the changes in healthcare to cause this gigantic increase in eating disorders, which is what you're seeing in this study here. So COVID and substance abuse. This is one area in which the adult and adolescent populations are definitely a bit different. Adolescents, adults have had an overwhelming increase in substance use during COVID. It has been, CDC has a lot of information on this. Again, the adult data is kind of outside the scope of my presentation, but please suffice to say that there's a dramatic increase in substance use during COVID in the adult population. The adolescent substance use has been a more complicated picture to track. It always is compared to adults because it's always involving doing illegal things. Keep in mind that the average 21-year-old who is drinking is doing something that's legal. The average adolescent who's drinking is doing something illegal. Again, same thing for THC. Even when you're in a state like Illinois where it's legal, it's not legal for 16-year-olds to be doing. So there's big barriers to getting data on this because of the legality involved, and there always has been. So people have done their best, and we've got a couple, studies to take a look at. One of the studies that was taking a look at overall substance use across many different domains in preteens. So this is a pretty young population. This is in the 10 to 12-year-old population. Saw a reduction in alcohol use, but an increase in nicotine and prescription drug misuse. So there were, kind of some things going up, some things going down. Certainly amongst the preteens who had COVID-related uncertainty. So these folks obviously did this study in response to COVID. They asked these kids specifically how they were dealing with COVID and how they were experiencing it. Those that noted that they had a significant amount of uncertainty related to it did have a dramatic increase in substance misuse, over 100% increase, a 2.37% increase. And then interestingly, this is a nice way to take a look at kids because some were going to school, some were doing virtual school, and some were doing like no school. And so they were able to show in those that kids who kind of were completely isolated from the school group, actually the lowest rates of substance use. Kids that were going to virtual school had a middling rate, and then kids who were going to physical school had the highest rates. This is not necessarily a huge surprise, but if you're new to thinking about the adolescent world, a lot of kids are accessing their substances from their peer connections. And when you put physical distance in, that is certainly responsible for some of those reducing. There are the idea with the alcohol and prescription drug misuse, of course, is that some of the alcohol that these kids get is from other kids and not necessarily just from home, whereas prescription drugs and nicotine are easier for them to access in the home is a reason why they found these specific findings they mentioned. And so they also came up with findings where they took a look at self-reported scores of depression, anxiety, and stress, like I mentioned above. And those were, of course, strongly correlated to substance use. This has obviously been known to be the case for a long, long time for adults and adolescents, but just yet another study to add to that compelling case that when you have these levels of pathologic anxiety, pathologic depression, or just high stress in general, that these are significant risk factors for going on to develop issues with substance use. Okay. A second study that was done, so the last one was looking at pre-adolescence. Now we're going to talk about high school students. This one was done, and the study design is not ideal. Remember, we don't have the perfect way to do this. What they did was shortly after the pandemic, they got a convenient sample of Canadian high school students to say, well, how much were you using the 3 weeks prior to COVID, and how much have you been using the last 3 weeks? And those were spaced out, like a month apart, those two periods of time. This is all done via the teenager respective recall. And so there are obviously ways that goes awry. But the data that they found was that there were actual decreases in some of the usage of the substances. In particular, cannabis and vaping had significant decreases, as did the number of days binge drinking. The latter makes a lot of sense, right? The kids were not going to parties a couple weeks after the world shut down. And so binge drinking from that standpoint makes sense. For them, alcohol was largely unchanged, but they relate to these teenagers getting alcohol from the home. But in contrast to that, the cannabis and vapes they were getting from their peers is their hypothesis as to why alcohol was relatively unchanged. And we had these decreases in these other substances used right after the onset of COVID. What was notable here, of course, is that a lot of kids were using in a solitary setting, which is associated with much worse outcomes in the substance use disorder realm, particularly at this early age, although the pandemic, I'm sure, changes that to some degree. And the other thing is that they already were seeing that about a third of kids were using substances remotely with their friends, which is to say, like, they would be on one of these calls together and they'd each be drinking or each be smoking or using other substances. So that picked up within literally weeks of the onset of the pandemic. They were already seeing a third of kids still using substances, but doing it electronically, socially, which is its own interesting thing to talk about in the future. So real quickly, a couple other things that are going to be a big issue. COVID and OCD, for sort of obvious reasons, particularly if you think about contamination OCD, is going to be a big concern. Obviously, with the things that are coming out of the government and our health departments, we tell people now all of a sudden to wash their hands a whole bunch. We've got alcohol gel everywhere on Earth. I mean, you can't go to any store or location on Earth and not run into these dispensers now. So these are really reinforcing of these obsessions that folks had with contamination concerns before. And it is very hard to get that nuance of saying, yeah, it's a pandemic, so we got to do this, but that doesn't mean that everything in the world was contaminated before and that you were right all along and that you should listen to, the obsessions that are going on and you should keep using these compulsions and that actually you had this adaptive behavior and, you were way ahead of your time with your OCD, right? And that is certainly not the message we want to get out, but very hard when all the news places are like, if you just wash your hands all the time, you wouldn't get COVID. People didn't exactly say that, but there were a lot of things, along that line. And so definitely an area in which the treatment is getting much more complicated and much more difficult. Notwithstanding all the things that we've talked about with all the mental health issues, it would be remiss to not mention that certainly COVID-19 can cause direct trauma. When kids are going through family members or extended family members who have COVID-19 itself, they may be on respirators, they may be in ICUs, they may be able to see them there in some cases, or they may not be able to see them there in other cases. And there's, certainly significant trauma related to having a parent die in a way that you can't see, significant trauma related to having a parent die from something like this in an ICU that you could see. So lots of issues related to the direct trauma. Now, certainly some kids themselves are getting COVID-19 scary enough to cause its own trauma. I will briefly share with you, since I think we're all friends here, when I had COVID very early on, I got it at the very start of the pandemic before we knew much about it. I had symptoms that were worse than I've had before in my adult life. And I had a couple days sitting in my bed. I was even not having my dog around because we were worried about my dog transmitting it to my wife. So completely isolated by myself, where I was kind of looking through my phone and thinking, is there anybody that I need to say goodbye to if things don't go well, despite being, an otherwise relatively healthy, guy in his 30s. And so there's certainly this level of trauma that comes from the pure isolation and knowing that you could have, a deadly illness associated with COVID that could be happening to anybody out there. In addition to that, just the process of quarantining itself is, we know, very harmful for mental health. So in the past, they've actually done research on children who were in quarantine situations for other illnesses, and they found that 30% of the kids that were in there ended up meeting PTSD criteria. Certainly, we also take a look at adolescents that are just having 2 weeks here, and we can see, at least subjectively, a lot of reports of worsening of mental health. I saw that all the time in my practice. Kids would be on COVID isolation, not even have COVID, but just be on the COVID isolation for an extended period of time, and then they would have worsening of their mental health going forward. So there is definitely, both a direct and indirect traumas associated with this. Other trauma to think of is certainly in the Asian populations. There's been a substantive uptick, hundreds of % increase in violence towards the Asian populations. Don't even know how to explain why that's occurring. It goes beyond my knowledge of the world. But be that as it may, there's certainly a number of people experiencing additional direct trauma because of COVID and people's responses to it. Okay, so there's obviously a lot that we don't know. I've mentioned in the past. Physically, there are likely going to be some long haul effects. There are people that have had COVID-19 and have longitudinal neurologic symptoms, lots of issues with taste, smell, sensory function, but also issues with their concentration, memory, sharpness of cognition, those kind of things. That is very in its infancy in studying. I think the head of neurology at Loyola is heading up something on that. So definitely an area that's going to need to continue to have additional research. This is clearly a generational trauma that everybody has been going through. But as I mentioned, it has had very divergent impacts. There are some people for which this has been terrible, other people of which it's been, run of the mill, really terrible. And some people who it has really not been that bad for, that have had large homes and had access to working remotely and had the same paychecks coming through. And so there's a big difference in how people are being affected by COVID. Certainly there's going to be this ongoing change. Like, we're still having this talk this way right now for obvious reasons with COVID, but the question is going to be, if for a year from now we magically get this all under control and there is no COVID, or am I still going to be giving you this presentation on Zoom, or are we going to get people back in person? And I think, that remains to be seen, but I do expect personally a significant amount of these virtual things to continue to be the case, both in the healthcare world as well as the business world. So there's a lot of changes that may make up an adolescent. They're seeing all these things happen. They're living through COVID, and then they're seeing the changes to society from an interactive standpoint moving forward, and what that's going to do to social relationships certainly remains to be seen. Obviously, like I mentioned in the beginning, the changes to sports, masking, social distance at school, just even something as simple as the handshake. There's a lot of changes happening for adolescents' life. Like, what are they going to do? They're going to have a terrible handshake, is my guess. But we'll see if that ever comes back. It's my old curmudgeon-y thing that I actually like. And then certainly what's happening right now is just not that well known in the adolescent population, certainly, but just in general. And so what we should do about it accordingly is not well known. And so everybody's still flying by the seat of their pants with how to deliver mental health care in the best possible way with the complications that we have right now related to COVID. And if that's changing adolescents' lives going forward, it's certainly not known. A few things real quickly. Adolescents certainly are very resilient individuals. If you spend time around them, hopefully you will have seen some of that. Like I said, basically all the data suggests that they are doing better than adults have done with this, which is a credit to parents, but certainly also a credit to the adolescents themselves. There is certainly some people for which the work from home has been good for their family. There's been families that have additional time. One of the studies I didn't show in here, they took a look at relatively poor Hispanic population in the southwest of the country, and they actually had an overall improvement in their mental health, these adolescents, during the beginning of the pandemic, which they attribute to their increased family time. And certainly there's a bit of the stereotype there that the Hispanic families really value their family unit, and they kind of thought to that as potentially one of the reasons why that may be present. And then certainly we know from that study and other studies that when we take a look and we get families and adolescents to rate their family relationships, those that have higher rated family relationships cope with stressors better. And so that's definitely something that can be done in the midst of COVID. We don't need specific data on COVID to know that that is the case. There are kids in rural areas and places that are not well sourced that have now had more access to care, that can actually get help that they was not able to get care in the past. So that's one thing that can be done to improve the resiliency of our youth here. And then certainly I think one of the biggest things to take away from COVID for everybody is that it is so incredibly universal. It can be very isolating to have mental health illnesses because you cannot walk up to a random person on the street and say, my family abused me when I was young. I can't stop thinking about doing something really bad. You just can't have those conversations with random people, but you can have a conversation with anybody about what's going on with COVID. And it's something that everybody gets and understands, and it is something that everybody can connect over. And so when we see these things affect whole communities of people, like vis-a-vis 9/11 that we've recently had the anniversary from, we can have people come together and support each other in a way that I wish we could have those things that I just mentioned that you can't easily talk about in our current society. And so this lets people support other people because it's such a palpable, salient thing for everybody, and it's a chance for everybody to kind of move together and help each other out through these tough times. So real brief tips and tricks, if any parents in here are wondering my thoughts on things. Family activities definitely are things that should be focused on more. We have good data on that, as I was just mentioning, and this is a perfect chance to develop some new habits and routines at home. I obviously just have random things that I'm partial to between board games, cooking, and puzzles, house projects, outside ones. I particularly like anything that's concrete. If you can point to it and say, I built that, I completed that puzzle, I cooked that meal, I help that plant grow from a seedling into something bigger. Those things are amazing things to be doing with your family during these times. And then certainly online courses, which you can even be doing together with your adolescents. There are things that they probably know more about than you that you could learn from them, and certainly some things that you guys could learn about together. Another thing we're talking about here is that this is, like I just mentioned, a very worldwide phenomenon. Everybody's in this together. But certainly make sure you're asking any individual child about how it's affecting them. There's a widely divergent response from COVID. Like I said, some people doing relatively fine with it, other kids who had a lot of problems because of it. Things may look different now than they did in the past because kids are just not interacting in the same way. So this is like that social anxiety that I was telling you about. Hard to see that when they're not having social interactions, and social anxiety does not present the same way when you're playing a video game and talking to your friend over Discord as it does when you're at school. And so if when these things are happening, just be vigilant. I think as we see more electronic time and social media time, making sure that you have some degree of conversation about what's appropriate, what's not appropriate, and how you're going to monitor that, really important. Big thing here is not to let COVID limit access to care. We talked about how that happened initially, but now certainly every place does virtual care effectively. Almost everybody does. And so making sure that we're getting at least virtual care, it's better than no care. And in instances in which you can do care in person, people can be masked and distanced and be safe. Obviously, don't let COVID stop you from getting help or letting your kids get help. And then certainly the final tip for parents is take care of yourself. As I mentioned, adolescents have actually done better than their parents, which is a credit to parents, but please, COVID has been very tough on the adult population, so take good care of yourselves. So just real quickly to wrap up, this is pretty obviously COVID being an evolving generational trauma. It's changed everything about life for everybody across the globe. Feels silly to say that as I'm talking to you on a Zoom call right now, but that's very obviously the case. Adolescents have faced huge disruptions because of this in basically all facets of their life, just like adults have. And we just don't know what that's going to mean moving forward. Society may be changing in some big ways, and we have to see what that looks like. So everybody will be staying vigilant and continuing to work on the research behind that. Social isolation and distancing is very difficult. I think social distancing was a terrible idea for the name. Really wish we called it physical distancing or something else to that matter other than social distancing, because the last thing we want during a pandemic or any other thing is for people to be socially distancing themselves. Those human interconnectedness is what gives us strength as a species. It's certainly what gives us strength against mental health disorders. And so hopefully we can continue to foster those. And then, of course, the family unit and the community unit, they play a huge part in kind of giving us strength through these times. We haven't had big calls for this in a while, and there's been a lot of concerns about families and communities drifting apart. There's been some data to support that. And certainly my hope is that if anything comes out of COVID that will be positive, it will be in the realm of families and communities working with each other again to strengthen themselves. So that's it for my talk. Happy to take any comments or discussions. Again, you can either enter it through chat, raise your hand through Zoom. We still certainly have some time to take those.
I have one. Sure. The data that you presented on the anxiety impact being greater on children 5 to 11 versus adolescents. What do you make of that? Any thoughts on why?
Yeah, so their hypothesis around that is that at that age range, it was much harder. They relied on physical interactions much more. And so not a lot of those kids have electronic developed, relationships, as opposed to adolescents in our modern time. Honestly, they were doing a lot of stuff already by phone, by social media, by Discord, by text, all those things. And so they've had actually relatively less disruption than any other group of people on Earth. Adults have had more disruption because they have less of their life that way. And the younger kids have more disruption because they're riding their bikes around town and doing stuff with people, locally and doing less electronically. And so that was one hypothesis around, potentially why we're seeing more of that disruption in the younger kids. And then obviously adolescents have an ability to understand more of what's going on. They have more frontal cortical development, more cognitive development than younger kids. I saw it all the time. It's very hard to explain to like a 5-year-old why you can't see grandma and grandpa. They're not coming to your birthday party. We're having people like drive down the street and honk their horn with like balloons coming out of their car. Like that's your birthday party now. Really hard to explain that to a 5-year-old, as I've experienced. So it's, it's definitely a different level of understanding for kids of that age range.
I just wanted to make a comment too on the, the resilience of young people and adolescents, and how we've seen, particularly with the overdose deaths that have skyrocketed among adults during the pandemic. From an adult's perspective, so many of our adult patients, when you dig into their early life experiences, have had experiences not like the pandemic, because none of us have experienced this before, but traumatic, stressful, overwhelming experiences that they seemingly were unaffected by, until they get to the transition between high school and college, or until they get to the transition to their first job, or, they bottom out with an eating disorder or drinking as an adult. So it's interesting to think about, kids experiencing these things that seem to accumulate, over the course of their life. And once they're out of the house into the adult realm, we see the emergence of, the genotype, phenotype. The phenotype emerges from the genotype, and the chronicity of the different life experiences that have impacted them.
Yeah, and actually one of the few downsides to it being so well understood is that, and so universally experienced, is that I think for kids who've had the harder experiences, who've lost family members, who've watched people die of respiratory failure, who've had it themselves and had severe health consequences, it's going to be something like, how do I get treatment for that? The whole world's been dealing with COVID, and I can just see that being a big barrier for kids that have had to go through that trauma, to feel like, why are they special? Why are they worthy for this treatment, even though they very clearly are, when the whole world has been suffering because of it.
I'll bring up one other thing then. Dr. Chevalier, you and I have talked about this, but what do you think about the governor's mental health days initiative for adolescents in Illinois?
Yeah, so I think as I've thought about it more, I do think part of where that came from also predates COVID, and has been this response and understanding that things have not been going well for adolescent mental health for several years now. Probably really 2013 is when we started to see the rise. And then I've seen data from 2013 to 2018. I'm sure, there's going to be some degree of corruption from COVID since then. But I think it's just very good and important for people to know that this is a huge problem. It's a big deal to have adolescents having all these issues now, because they are associated with worse problems in the future. They're associated with people not getting the life they've wanted to live, not be able to contribute to society in the way they want to contribute to society. And really important that we invest more into the mental health, of our youth. We do all these classes starting from kindergarten for physical education. You have to be in phys ed every single year through 12 for the most part, a little bit different in high school, but for the most part, at least a semester a year. But we do nothing for the mental health side of things. And there have been pilot studies already that have taken a look at what happens when you teach teenagers mindfulness, what happens when you go in and teach basic mental health, hygiene, and curricula. And they've all shown huge returns on investment, huge changes. This is stuff that has been done. It can be done. It doesn't get scaled because the money's not there, the will's not there from people, and it's easier to kind of push it under, a rug until you can't anymore. But certainly, I think it needs to be an area of growing understanding and importance, and this is something that requires active effort and active transport to address. Obviously, whether or not giving kids 5 days off of school is going to actually change their mental health is a different story. But at the very least, I think the messaging of saying your mental health is important and that we should be concerned about your mental health is absolutely the kind of message that we need to be having for our youth. But there's certainly a lot more to it than giving them 5 PTO days to solve it. So I look forward to additional thoughts and work to improve it further.
Dr. Dennis, what do you think about the Mental Health Day for adolescents?
Well, I think just as you said, Alex, it's the social emotional learning curriculum that needs to be broadly implemented, across the board in our school systems, elementary, K through 12, pre-K through 12, really. And I think this is one of the areas where systemic racism is evident, because in North Shore elementary schools, for example, from day one, kids have a social emotional learning module, and they're doing that all year long, and that's not uncommon in school districts that are well funded, right? But how many of the K through 12 schools in the public city, in the public schools of Chicago have anything around that built into their curriculum? Much fewer. And I think we're going to continue, and we'll see an impact, on both mental and physical health for those kids who aren't getting it. David, do you want to share with people how to get the continuing education credit for this talk?
Sure. So we are this talk will provide 1.5 CEUs. So if you didn't get our email with the form, please send us an email with your email address at info@suncloudhealth.com, and let us know you need the form. We'll send it to you, and then if you would be so kind as to just complete it and return it to us, that'd be great.
Great. Thank you again, everyone, for coming and joining us. And big thanks to you, Dr. Chevalier, for a wonderful presentation.
Yeah. Thanks, everybody, for your time.